Okay, so this is my video interpretation for client 3. No in-body access, so we use the US Navy method and measurements to get the calculations that we need. So at 85 kilo body weight for a female, for the height as well, we have estimated at 30.8% body fat percentage. Does a lot of gym training over the years, all kind of weights and stuff, so we would imagine that the muscle mass is probably going to be a bit higher than what's kind of estimated, so possibly a little bit less on that body fat percentage, but still it's very high for the weight and height. So looking to lose body fat, it is in her goals that we want to lose it, so we're going to use scale weight, but mainly the measurements to track the progress there, and have a look at the nutrition end of things when we have more of an exercise habit in place. This client has a history of a lot of yo-yoing, so up and down with this kind of all or nothing type of approach to training and eating, so it's usually very full on for 6 days a week, cutting back calories a lot, and then off the wagon for a few months at a time of not tracking anything and eating what you want and not training at all, because there's that habit built in over the years. So what we want to do first, just for the first cycle or two even, is to just get a good healthy relationship with the gym in place. Training sessions 3 times a week, so every second day a day off. We'll do 3 full body resistance days, Monday, Wednesday, Friday I think, and then the day off is, she doesn't get out for a lot of sunshine, so we're going to do the MAP 10 walk on those days off for active recovery and take it out for 60 minutes. Yeah, this should give us a good start, because she needs to have a healthy kind of a balance of enjoying the training but not having to go and push herself and kind of hammer herself in the gym like 6 times a week, just to kind of see results. So we'll build from there. We'll make sure that the BLGs are kind of centered first around what needs to be prioritized, which would be not too much food quality. It's quite good, judging by the MyFitnessPal. Like I said, she's very used to going for big healthy bouts of eating for months at a time, so just having a bit of more focus on the meal timing, perhaps, and definitely the food hygiene, so not eating so fast, slowing down those snacks and meals, and being more mindful and present. Using the simple chew, counting the chews and putting fork down, so that we can slow down a little bit. And then hydration can be poor some days, not every day, but building a habit of having, we're trying to up it to where it should be daily, so just adding that extra glass of water in the morning, so that we have it early, you don't have to think about it then, and continue on with the hydration throughout the day. And the second would be then we'll have a look at the tracking when we get a bit of more habit around balance, kind of for the first cycle or two. We'll look at maybe calorie target then, with an emphasis on protein to sustain the gym sessions and recovery. We'll track our weight as we go on measurements. Just with the move assessment, scratch test was a pass. Not 100%, but it was quite good, a good level, good overhead reach both sides. More range on the right side with the under reach, so a little bit of imbalance there, just tightness we think on the left side anterior. And just a very, very slight rib flare on both sides. Those side planks later on are kind of showing very, poor enough as well, so we definitely need unilateral strengthening. So single arm carries and single arm push for that you know, to go from horizontal first because of the little bit of range of motion issue. Lots of mobility work. It's those prone and supine core exercises, dead bug variants, quadruple lift-offs, prone lift-offs, these kind of exercises for shoulder stability, and maybe some core isolation as well. Push, let me see. Yeah, with just push and pull, we go single arm, with dumbbells mainly, just for that unilateral work as well. Tempo work, you got that time under tension, simple ring rows, pull aparts, cable rows, farmer's carry, different variations of offset carries and front rack. You know, just get that upper body up, you know, strengthened and balanced. With squat, it was a fail. A huge lack of depth here, so there's a hip mobility issue. This client has been to different doctors over the years, specialists to do with bones. She has a kind of a hip impingement, which there's a lot of pain when trying to squat down there. They can't kind of give her a pinpoint diagnosis of what's going on, but there is some kind of a bone issue. So she does have to avoid all squats, full depth anyway, until she can kind of get further explanation on that. It does affect the lunge as well a little bit, but you know, we need to take into consideration that the lunge is probably a little bit better in terms of being able to do it assisted in that. So with the squat, we'll leave it out. We'll do step ups instead, glute bridge variations, hand supported, split stance, lunges, sled push, flat foot, with moderate weight, wall sits, and then just a little bit of an assisted squat to partial range, and rowing as well. And we're going to go lunge was a fail as well. Again, that hip issue, it's causing restriction. There definitely is imbalance one side too, so she could not control, you know, into that bottom position. There was a collapse and not being able to get back up, so knee restricted, and a bit of weakness in there to get back up. So we will include a hand supported variation with the rig, if there's no pain. She seemed okay with the lunge, but we'll avoid kind of until the strength and stability improves. So just partial range with hand support, and again those single leg variations on the glute bridge, the step up, time under tension with those exercises to begin, and of course the sled push and the row and stuff like that, exercises that will recruit the leg muscles. Also looked like the back, her lower back was arched a little, so she's a little bit of awareness there just to kind of keep her torso vertical, possibly with a lack of core control, so just more core exercises as well to strengthen. The toe touch was a pass. It's good level, so we can include hinge patterns in the program. There was no hip shift, and it looked very balanced and good hamstring range. Same with the active straight leg raise. It was a pass. It was just a slight bending of the right leg around that upper knee, so just a little bit of tightness in the hamstring there. So some stretch included, and mobility work, and possibly a little bit less range through that right side as well. So the left leg definitely gets to a good nice free angle. There's good range there. So we'll include those closed kinetic chain like bird dogs and supine work, and then move to prone exercises. Just like foam rolling through the hamstring as well, and stretching out, including some active straight leg raise exercise variations, with high reps, just time under tension, so nice and slow, low load, hand supported, RDL, progressing on there then with light load and maybe kettlebell, and then onto some like deadlifts as well. With the front plank, it was a fail, 45 seconds, couldn't hold it for 60. Did say she felt weak in her shoulders, and after rewatching the assessment, like she was failing to maintain a neutral spine kind of halfway through, so a bit of arching through that back. We see a lack of muscle endurance in anterior and the posterior chain. Like the reverse plank was a fail as well, and weak only to the halfway point. So we want to definitely throw in a lot of isolated glute and hamstring exercise, and single arm work for the front plank to strengthen up as well, and just front plank variants, isometric core exercises, 2. The arch in the lower back, it might also indicate that she can't maintain shoulder protraction, even though the shoulder range of motion is decent level. So we can see that it's muscle endurance, maybe anterior chain is weak. Possibly a bit of body awareness. Wouldn't have done much of this kind of training really, so with front planks and that. So we'll just include those in our priorities. Strengthen there. Yeah, just going back to reverse plank, she did have good angles, but it wasn't maintained, only halfway, so definitely the muscle endurance posterior. And we've gone through that there. Single arm pressing and carry variations. And then side planks, both fail. Left 43, right 50 seconds. Can't hold 90 either side, and you know they're only just about halfway, over halfway. So both side planks, the 2 main faults were the inability to maintain a straight torso, the upper shoulder like leaning forward, definitely worse on her dominant side, and then the shoulder shrugged up to the ear, so passing the shoulder, like not maintaining a neutral head position. So a little bit of awareness there maybe, but you know, didn't look comfortable. And the same potential causes here: spinal endurance, core strength, shoulder stability. So again, we have these exercises priorities included anyway, the single arm carries, and then we'll include side plank to begin just on the bent knee, and progress from there in the time, and in kind of introducing more complex side planks as we get stronger in them. Midline was broken towards the end, so I think some glute and hamstring strength isolation work as well, which we have that included too. So that is the move assessment, and then just taking it to the work. We've got 92 calories on the air bike. After looking at the conversion, we see that, like, for her body weight, it's not good. The overall calories is showing, like, definitely that the power output is not there, and so that ability to kind of really express power is not going to allow us to progress down further in the map. So we're just going to stick with map 10 just for those days off, 60 minutes of walking or hiking. She enjoys that. A bit of bike work maybe, get a cycling outside as well. So getting outdoors for the sunshine. She's very used to going in the gym and doing a lot of high intensity training, so it's just to build in this habit of just doing more strength, and correct imbalances and on all the priorities we need to look at. So those 3 full body resistant days will just be resistance work days, and then after the first cycle or 2, as the the body gets a bit stronger, and that we'll look to retest the assault bike, and see if we can improve upon it, and then progress then after our 6 to 8 weeks onto map 9, and start including more mixed modal and cyclical workouts in around the kind of maybe 30-minute range, but at those map 10 and map 9 paces. Yeah, so I think we've hit everything there of importance, and that is client 3.